world's most consumed spirit is not vodka, not whiskey, and not baijiu. It is soju, a clear Korean liquor that most people outside East Asia have never tasted. According to the World Health Organization's Global Status Report on Alcohol and Health, South Korea ranks among the highest consumers of distilled spirits per capita on the planet, regularly surpassing Russia when measured in pure alcohol terms. A country of 52 million people is collectively drinking more hard liquor than a nation of over 140 million. That single fact deserves a serious explanation. What combination of culture, economics, and social structure produces that outcome? And what does it quietly cost? The WHO's data places South Korea's recorded pure alcohol consumption from spirits alone at roughly 5 to 6 liters per adult per year, a figure that consistently exceeds Russia's in comparative rankings of distilled spirit intake. The brand Jinro, produced by HiteJinro, has been certified by the Guinness World Records as the world's best-selling spirits brand for more than 2 decades straight, moving over 90 million cases annually at peak years. A standard 750 milliliter bottle of Soju retails in Korea for roughly 1,300 to 1,700 Korean won, under $2, making it cheaper than a bottle of water at many convenience stores. The Korea Health Promotion Institute has reported that roughly 1 in 5 Korean adults engages in what it classifies as high-risk drinking. And according to Statistics Korea, alcohol-related economic losses, including lost productivity, medical costs, and accidents, were estimated at over 9 trillion Korean won per year as of the early 2020 period. 3 interlocking forces produce this outcome. The first is price engineering. After the Korean War, the government actively promoted domestically produced diluted soju over imported spirits to conserve foreign currency. Tax policy and production subsidies kept the price floor extremely low for decades, and that floor became a cultural baseline. The second force is social architecture. In Korean workplace culture, drinking with colleagues, hoesik, has historically functioned as a near mandatory ritual of loyalty and hierarchy. The Confucian emphasis on collective harmony meant that declining a drink poured by a senior figure carried real professional risk. Anthropologists and sociologists studying Korean labor culture, including researchers published in the Journal of Korean Studies, have documented how hoesik became embedded in performance expectations. The third force is geography of pleasure. Korea's dense urban environment, dominated by small apartments, pushed social life outward into restaurants, noraebangs, and poryangmatcha stalls, where alcohol is the social lubricant and profit engine for every venue owner. The costs operate on at least 3 levels. At the individual health level, the World Health Organization links heavy spirits consumption to elevated rates of liver disease, esophageal cancer, and cardiovascular damage, all of which appear at notable rates in Korean health statistics tracked by the Korea Disease Control and Prevention Agency. At the social level, domestic violence advocacy groups in Korea, including the Korean Women's Development Institute, have consistently found alcohol to be a factor in a significant proportion of reported intimate partner violence cases. At the economic level, the calculation becomes paradoxical. Soju generates enormous tax revenue and supports hundreds of thousands of jobs in manufacturing, hospitality, and retail, meaning the government has a structural incentive not to aggressively curtail consumption. That tension between public health goals and fiscal dependency is a pattern seen across alcohol economies worldwide. But Korea's version is particularly sharp because the product is so cheap and so embedded. Korea's soju economy is not an anomaly born of recklessness. It is the product of deliberate policy choices, cultural architecture built over generations, and an economic structure that made vice affordable by design. Younger Koreans are actually drinking less than their parents. Surveys by the Korea Health Promotion Institute show measurable generational decline. But the infrastructure of drinking remains deeply wired into social life. The universal pattern here is this: when a government engineers cheapness into a harmful product to serve an economic goal, the social cost does not disappear. It is simply deferred and dispersed across healthcare systems, families, and lost productivity. Every country that has subsidized tobacco, alcohol, or sugar has eventually paid that bill. Korea is still tallying its portion. The question for any society is not whether the cost arrives, but who is made to bear it.